Victoria, thank you so
Yeah.
much for joining us. We're going to be talking about mental health and burnout for healthcare workers. So I know you've guessed on a few interviews with us, but I'm wondering if you have the time. Can you give another brief introduction for anyone who has not met you yet?
Okay, well, I'm Victoria. I work with Direct Shifts. It's been almost a year now. A few days will be a year. So I am a med-surg nurse. I've been a med-surg nurse for about 7-8 years. I just received my master's degree in family nurse practitioner, family health. So I am looking forward to starting a career as a practitioner.
Right, you're experiencing a lot of really extreme cases, especially in med-surg. What does your typical day at work look like?
So my typical day, so I work in a hospital that's in a very underserved community. Unfortunately, there are a lot of patients who are dependent on drugs. And so my day, on a typical day, it looks like I would give, I medicate everybody. We also have a high prevalence of sickle cell patients. So I give a lot of pain medication around the clock. I give a lot of what's called methadone. It helps heroin users try to kick the habit. And I basically, we run around all day. And unfortunately, our Epic system is down. We were under like a cyber attack. So we're paper charting right now and indefinitely. So right now, days are looking more hectic as opposed to the not so hectic days because we have a computer to help us. But yeah, the day pretty much starts as soon as I walk in the door. And when I take a break, if I get to take a break, take a few 10, 15 minutes and unwind. And then you go right back into the chaos. So yeah, that's a typical day.
And that's a lot. So when we think about that kind of level of stress, right, and you're multiple years into your career. So this is not new to you. This is something that you've kind of got adjusted to in a lot of ways. So when we talk about stress and burnout, how has that personally impacted you?
So I've experienced burnout. I've experienced fatigue where you hear the call bells, the pumps going off, while you're home. You just hear it. And I've become so immune to it. But I'll also be very honest. I am a very cool, calm person. I really work well under stress. I've just tried to practice that when I first started nursing. So it doesn't bother me so much now, but in the beginning I was very stressed, like, okay, I have to give meds. If I have an hour before and an hour after, that 2-hour window, I was trying to get through it all. And you almost stress yourself out, like, okay, I have 7 patients, I just did 2, I have 5 more. How am I going to do it in 40 minutes? Like, that's the type of things that I would worry about. Nowadays, I'm more prepared, and there are times where I try to come in early just to read the patient's chart to see, okay, this is what I have to do. Start with this patient first. I could do this patient last. And, it's become, I guess, a routine where I just try to, really de-stress by just saying, okay, it's going to be okay. Today's going to be a good day.
You think about the burnout that you felt. How did you know what it was? What were some of the physical symptoms that you used as that guiding point to recognizing that that's what was happening?
Okay, so I was not getting enough sleep. It was so hard for me to fall asleep. 2, I wasn't hungry. And 3, I was very irritable. Like, those were the 3 things that I would say I was experiencing. And every now and then, I don't have an appetite, or I don't say I'm irritable anymore, but more so just not being hungry. But I was very irritable, and it was due to the lack of sleep. And oh my God, like, there's just some days that it's just not your day. And I was experiencing that, off and on for so long at my previous hospital. So I definitely would say those were the three symptoms that I was experiencing. And you have to, it's hard to understand what you're going through and recognize it in the moment, but something just clicked one day and I was like, okay, you're gonna kill yourself if you let this affect you. So, you know, eventually I was like, okay, today is a new day, say a prayer, and hope to God nothing happens.
Yeah, of course. And I think, well, I just want to thank you for sharing something that is really so
And
personal to you, something that you've gone through. It's really kind. And the hope is that people will watch this and other nurses can sit there and go, okay, it really isn't just me. There are a lot of nurses out there from things or clinicians that are dealing with symptoms just like yours. What are some
yeah.
other ways, aside from sleep, right, and taking more time, what are some other resources do you think would be really valuable for healthcare workers to really try to get them out of that burnout?
I think we need to, I think talking to somebody, like whether it be a therapist or um, maybe even like a former nurse. Like I know ANA, American Nurses
Mhm.
Association, they have, if you remember, they have people you can talk to, like former nurses that are just there for you to just talk and who have been in your shoes. So I think having outlets like that, whether it's a therapist, a former nurse, your mom or your like a parent, somebody that'll just listen to you for a few minutes every day. I think that would be a good idea, just to get it out, get it off your chest.
Yeah, of course. I think that's a really important thing too. And in your experience, right, all of those things are very helpful. But what can healthcare organizations do to really address some of these problems, not just by offering therapy, but are there other things that are possible for us to really enact change so that way mental health and burnout isn't so prevalent across healthcare?
So California currently is the only state that has a safe staffing laws. Um, New York was in the midst. They had passed an act, but it hasn't been finalized regarding safe staffing. That's the biggest thing is you have so many patients you have to take care of. So I think if our local legislation was able to pass a safe staffing law, I think nurses would be. I think we would do so much better. Our patients would get better care. Honestly, like the patient's acuity sometimes is very high, and we're not. We can't take care of everybody, the way that they deserve to be taken care of. So I think if we had better staffing laws for safe staffing, we would be, so much better.
Yeah, and it's not an easy thing to do, right? Especially if
Yeah.
only one state is offering that, but it is a good start, right? And it's
Yeah.
an
Yeah.
example that other states can then look at from a legislative perspective because realistically, mental health right now is a crisis. It is an
Mhm.
epidemic at this point. I just really want to thank you so much for your
Yeah, Rachel,
time
it's
and
been such a pleasure.